Good morning, good afternoon to all of you. Welcome to this webinar on climate change negotiations and health, organized by WHO, the World Health Organization, UNITAR, the United Nations Institute for Training and Research, and UNCC Learn, the One UN Climate Change Learning Partnership. Many thanks for participating in this event. My name is Cristina Recacavas. I work as a Green Development and Climate Change Specialist at UNITAR, and I'm the coordinator of the UNCC Learn program. I have the pleasure of moderating today's webinar. To officially open the webinar, I would like to invite Ms. Marina Mayero, Technical Officer, Climate Change and Health at the World Health Organization, to deliver her welcome remarks.
Good morning, Christina. Good morning or good afternoon, evening to everybody. So great to see so many people joining us, and still you can hear the bling bling. We have many participants still connecting. So welcome from the World Health Organization. As Christina mentioned, my name is Marina Mayero, and I'm responsible of partnership and advocacy for the climate change and health team in WHO, the World Health Organization in Geneva. Together with me in this call, there are several colleagues from my team. We'll be happy to provide you later an overview with the work that WHO is doing on climate change and health, and some highlights on the upcoming work on the COP27. And so we'll provide this presentation a little bit later on. This is just to say hi to all, welcome, and also to express our gratitude and just restate once again how we appreciate working with UNITAR and UNCC Learn team. For us, this webinar and the online course that we have prepared together on climate change and health negotiation is really an important piece of work and tools that we are offering to general public, professional, environmental activists, to everybody who wants to understand the linkages between health, climate change, and how in the negotiations we can really promote the health argument to stimulate more ambition in these very complex negotiations war about climate change. So without further ado, because you will hear from me more later on, I pass back to Christina and UNITAR colleague. Just welcome again, and so nice to continue hearing the bling bling of many more connecting. Over back to you, Christina.
Thank you, Marina. Thank you for your kind words and also for framing the webinar. Now, Mr. Angus Mackay, Director of the Division for Planet at UNITAR and Head of the UNCC Learn Secretariat, will deliver opening remarks from the UNITAR side as well.
Thank you, Christina. And good morning, colleagues. So a very, very warm welcome from UNITAR and the UNCC Learn partnership to this webinar series. UNCC Learn is a global One UN initiative hosted by UNITAR. It's been up and running for about a decade now. And one of the things it does is to provide a single entry point into the UN system's knowledge on climate change through training courses, most of which are free. In fact, I think pretty much all of which are free. And so it's great to have WHO as a partner to UNCC Learn, and we have been working very, very effectively, I think, with WHO over many years. And I'm delighted that this topic of climate change and health is getting increasing attention at the global level, and also interest, as witnessed by the number of people who joined this webinar yesterday and are joining today. And we've also, by the way, in case you're not aware, we've been able to update the online course on negotiations and health, which goes with this webinar series with support from WHO. So I hope some of you, if not all of you, have had a chance to look at that excellent course. We find that this combination of online self-paced courses with a real-time webinar is quite a good way to extend the learning experience. It should help to consolidate your knowledge and understanding, but also build the personal confidence that we all need towards taking action, because ultimately we don't take training courses or participate in webinars unless we have intent. And we hope that these various products combined together will give you that energy that you need to take action in your community, in your job, in your life. Because it is vital that parties to the Convention on Climate Change and the Paris Agreement have the knowledge and skills to be able to push forward this agenda, particularly as it relates to adaptation and the lives and livelihoods of some of the most vulnerable people. And you may know that the coming COP27 in Egypt, which is happening next month in November, has been informally named the Adaptation COP, and for a very good reason. And it's because of the accelerated effects of climate change that the world is facing today, and the human health dimension being a very significant part of that. This is the way that families and communities are hit in a very specific way, and particularly the most vulnerable and weaker in society. And you may all have, unfortunately, personal experience of the way this is happening. We know that there are multiple ways in which human health is being affected by climate change, both directly, for example, through the direct effects of flooding or heat waves, or indirectly, for example, through the impacts that climate change has on national budgets, which then has a distributive effect across all sectors. So all of that is happening. And again, just to plug the online course, if I may, I mean, this course does provide a very useful summary of all of these different types of effects, but also the actions that can be taken. So I very much hope that you will find the format today engaging and useful. If you do give us a thumbs up or a comment in the chat. And if you have suggestions on how we can make it better, that's equally well received, if not even better received, so that we can continue to improve the products that we put out. My thanks once again to colleagues and friends at WHO, to my team. Many thanks for listening, and I hope you have a good seminar. Back to you, Christina.
Thank you very much, Angus, also for framing the discussion of this webinar so well, and also for introducing the importance of investing in climate change learning to be able to address the challenges associated to this threat. Great. Let's now have a look at the objectives of this session. As you may have seen from the program, there are three main objectives. First of all, we aim to present the newly updated e-learning course on climate change negotiation and health, which is available on the UNCC Learn e-learning platform. Secondly, we would like to provide an overview of the most recent climate change negotiations and their key milestones, with particular reference to health. And finally, we would like to highlight the health priorities for COP27 and how the health community will participate in this conference. With regard to the agenda, after this welcome and introduction segment, we will provide an overview of the course and then expert presentation on climate change negotiation and health. You will then have the first possibility to ask questions to our experts. This will be followed by another presentation focusing on the health priorities for COP27 delivered by WHO, followed again by the possibility for you to ask questions and share your thoughts. We will then summarize key points and conclude. With regard to the online etiquette, I believe everything you see on screen is common, familiar to you. We kindly ask you to keep the camera on at all times to facilitate communication if possible, and to mute your microphones when you're not speaking. You're most welcome to raise your hand through the dedicated function on Zoom if you'd like to intervene, or also to use the chat function. I would like to remind you that this webinar is being recorded and is currently live streamed on the UNITAR YouTube account as well. For any technical issues, don't hesitate to contact my colleague Julia through the private chat or via email. And you can see the email here on screen, her full name, Julia Villalba. She will also share her email in the chat. Excellent. So before zooming into the content, now we would like to get a sense of who is with us today. And to do so, we would like to invite you to participate in a short poll. So please select the answer that is most relevant to you in the pop-up boxes that will appear on screen in a second. Great, I can see the first one. Which region are you from? Please do let us know. Great, a lot of answers coming in already. Okay, so I see the most of you come from the Asia-Pacific region, 34%, followed by closely by Africa, 29%, and North America. And then Middle East and Latin America and the Caribbean. And yes, so thank you very much for those in Latin America connected with us, even if it's very early. Great. We can now launch the second question. What is your background, your expertise? Do you represent the health sector, the environment, climate change sector? Are you a diplomat or part of the diplomatic community or another sector? Thank you. I see a lot of answers coming in. And most of our participants are from the environment sector then, 47%, followed close by other, so multiplicity of other sectors, I believe, and then health and diplomacy. So also quite an interesting mix of backgrounds and areas of expertise. Okay, so our third question focuses on your experience in climate diplomacy, and particularly if you have attended COP before, and if so, how many times? Okay, it seems that most of you have never attended COP, around 84%, 95%. 11% have attended 1 to 3 COPs, and 4% are really experienced delegates, having attended more than 3 times. Great. Final question now. Will you attend COP27, which will take place in Sharm el-Sheikh in November? Okay, I can see that most of the respondents seem not to attend COP27. Around 75% will not attend, and 27%, 26% actually, will attend. Okay, great to hear almost a third will be there. So really a great mix in terms of participation experiences and interest, I believe. So thank you so much for participating in our poll. We can now move to our next segment. Here, as mentioned, we are delighted to introduce to you the newly updated e-learning course on climate change negotiations and health. The course was launched last year in the lead up to COP26, and it has been updated this year to take into account the results of this conference, as well as the key issues to be considered at COP27. The course is free, self-paced, and can be taken at any time. It is available in English and takes around 3 hours to complete. It primarily targets delegates attending the conferences to the United Nations Framework Convention on Climate Change, or COPs, and those participating in climate diplomacy. It also provides valuable insights for professionals involved in the development and implementation of national climate change and health policies. And in addition, it could be very relevant for academics and any other individuals interested in learning more about the promotion of health priorities in the context of climate change. The overall objective of the course is to support participants in addressing health within climate change diplomacy and national policy processes, as well as in considering climate change in health policies. You can see on screen the specific learning objectives, highlighting what you will be able to do at the end of the course, which includes being able to explain how climate change affects health, recognize the international climate change policy framework, identify the parties and group of parties to the UNFCCC, the Kyoto Protocol, and the Paris Agreement, including the respective commitments, describe the outcomes of past negotiation sessions, and finally discuss the key issues in the ongoing international climate change negotiations, particularly in relation to the promotion of health priorities and the integration of health in all policies. The course includes 6 self-standing interactive lessons with different activities, exercises, case studies, videos, and a multiplicity of links to other resources for more in-depth information. These lessons are, well, lesson 1, Introduction to Health and Climate Change, which focuses on the nexus, highlights the health risks arising from climate change, the impacts of these risks across different communities, and possible health responses to climate change. Lesson 2, History of the UN climate change negotiations, explore key milestones in climate diplomacy, focusing in particular on the Climate Change Convention, the Kyoto Protocol, and the Cancun Agreements. Lesson 3, the Paris Agreement, discusses the objectives and the main provision of such an agreement, and also highlights the purpose and mechanisms of the NDCs, the National Determined Contributions. Lesson 4, From Paris to Glasgow, highlights the key outcomes of COP25, which was held in Madrid in 2019, and the key topics discussed at COP26, held in Glasgow last year. Lesson 5, Health in UN Climate Change Negotiations and Beyond, is a completely updated and overhauled session and highlights key entry points for advanced health priorities at COP27 negotiations, WHO's recommendations and priorities for action at COP27, and more generally, how to build climate resilient and low carbon sustainable health systems. Finally, lesson 6, Healthy and Green Recovery from COVID-19, focuses on the impact of the pandemic on our health and societies and introduces 6 prescriptions highlighted in the WHO Manifesto for a Healthy Recovery from COVID-19. All these lessons can be downloaded as PDF also for offline study. A quiz at the end of the course allows participants to measure the achievement of the learning objectives, and those that are successful are then awarded a certificate of completion, such as the one that you can see on screen. The course is available on the UNCC e-learning platform, as I mentioned earlier, and the link is available at the end of this presentation and will be also shared in the chat. Please feel free to register if you are interested and haven't done so yet, and to disseminate also the course widely. Now, during this webinar, we will have the possibility to go deeper and complement some of the content that is highlighted in the course. To do so, I would like now to invite Mr. Marcelo Rocha to provide complementary information on the latest climate change negotiations. Marcelo has a long-standing experience as advisor to the Brazilian delegation at the UNFCCC, the Kyoto Protocol, and the Paris Agreement, and also as a UNITAR trainer, among others. Marcelo, you have the floor.
Thank you, Christina. I hope everybody can hear me well. And let me first thank UNITAR and WHO to this invitation. It's a pleasure to be here. I want to share a little bit of the experience that I had in these many years of climate change negotiation, but also learn from you as well. I'm not a health expert. My background is more on transparency, MRV, mitigation. So I also want to learn from the participants this very important aspect of adaptation, particular health aspect. I'm going to go through a couple of slides, so then feel free to put questions in the chat and also in the QA session, raise your hand, make your comments, your questions. Please, next slide, Christina. We will not go, of course, in all the details of climate change negotiation due to the time constraints that we have. So I encourage you to go to the UNITAR training. There's a lot of information there, a lot of good material, and you will see a more complete picture of what is the climate change negotiations. And of course, within the material, you're going to find links to the web page, particularly the UNFCCC web page, where there is a lot of information. So I hope this can be used as an interest door to this very important topic of climate change. And there you're going to find different types of information. So here, let me pick up some of this information just to give you some initial thoughts. And let's start with some what we call milestones of the climate change negotiation process. And of course, I'm not doing all the milestones, just a few ones. And I have chose here to start with the Paris Agreement that was adopted in COP21 2015 in Paris. This is why the name Paris Agreement. And this is a very important agreement within the UNFCCC climate change negotiations, because different from the Kyoto Protocol, where we had targets, mitigation targets, emission reductions of greenhouse gas targets for developed countries only. Here in the Paris Agreement, we have targets to all countries, developed and developing countries. And also important difference here is that those targets were defined by the countries themselves. We did not negotiate the targets of the Paris Agreement. The Paris Agreements allow countries to bring their own targets, and these are called the nationally determined contributions, NDCs. And one very important aspect of the NDC that we're going to discuss in much more detail later on here is the adaptation component of the NDC. We're going to discuss this a little bit later. For the time being, I just want to stress the importance of the Paris Agreement and these two characteristics. First is an agreement that the parties themselves have decided on the targets, and these targets are called or are described in their nationally determined contribution. The Paris Agreement is already into force. It entered into force on 4th of November 2016, so it was a very quick entry into force, different from the Kyoto Protocol that took 8 years. The Paris Agreement almost immediately entered into force. And this is, I believe, is because of this nature that it's a self-target of the Paris Agreement. If you read the Paris Agreement document, you will notice that it's a document that would not have all the details on how the Paris Agreement should be implemented, how countries should implement the NDCs. And that's natural. I mean, you cannot, in an agreement, put all the details. So we had to negotiate these details later on, and we managed to have what we call, or some of us call, the Paris Rulebook. That is a set of decisions that then give all the details that countries need to implement the Paris Agreement, to implement their NDCs. And this Paris Rulebook was the decisions that comprise the Paris Rulebook. They were decided in COP24 in Katowice, Poland, 2018. And we're going to discuss some of these decisions, particularly the ones that are related to transparency, the enhanced transparency framework of the Paris Agreement. Later on in COP26 in 2022 in Glasgow, we had also another set of decisions, including what we call the transparency tables, or the tables that parties will use to present the information related to the NDCs, and also the rules for the Article 6. Article 6 is the article in the Paris Agreement that set up the carbon market instruments. So the Paris Rulebook, together with the decisions of Glasgow, give us, I would say, 99% of what parties need to fully implement the Paris Agreement. There are some details that we're going to discuss in COP27, and I'm going to highlight some of them. But at the end of the day, next slide, please, Christina. We are on what is an implementation phase of the Paris Agreement. The rules are 99.9% complete. So parties, countries can and should have been already implementing the NDCs. And as I said, the NDC has two components. One is the main objective, I would say, of the Paris Agreement, or related to the main objective of the Paris Agreement, is the mitigation component. That is to set up targets to reduce greenhouse gas emissions or to remove from the atmosphere CO2. These mitigation components, they are very different types of it. It's not the objective of this webinar to discuss this component, but just to give our overall view, here you can find this picture from the one paper from the UNFCCC secretary. Once you receive the presentation, you will see here the source, and if you click UNFCCC 2021, we'll drive you to the link, the web page of the UNFCCC, where you can find this paper, and it will describe in much more detail the different types of the NDCs. So for the time being, just to show to you that there are different types, 35% of them are what we call absolute emission reduction target. That says that you have amount of greenhouse gas emissions in your country, and you want to reduce this emission by X%. Another important type of the NDC, mitigation type of the NDC, is what we call the deviation of business as usual. So you have a trajectory of emissions that you call business as usual, and you want to implement policies and measures to mitigate those emissions and then deviate from this trajectory. And there are many other types. Again, we don't have the time to discuss the mitigation component, so I invite you to go to this web link and then find a little bit more about the NDCs. Next one, please. What we want to emphasize here is the adaptation component of the NDC. In the beginning, when we define, or in the Paris Agreement have defined the NDCs, they were target for the mitigation component, or to emission reductions or removal of carbon from the atmosphere. But then many parties start to realize that was also necessary and important to include in the NDC an adaptation component. Unfortunately, we are already suffering from climate change impact, so we need to adapt. So you're going to find in all NDCs of 99.9% of the countries, both mitigation and adaptation component. And the adaptation component, of course, is quite diverse. Here in this figure from the same technical paper of the UNFCCC secretary, there is this mapping of what has been included in the adaptation component in terms of adaptation priority. And you can note that here in this figure that human health has been included in almost 70% of the NDC as one of the adaptation priorities. And that makes sense. Colleagues from WHO will go a little bit in details on this, but unfortunately we have also, as part of climate change impacts, a lot of health issues related to it. And therefore there is this priority in the adaptation component of the NDCs. Next one, please. So here in these bullet points, there are some of highlights of how this component had been included or described in the NDCs. There is the details in the UNFCCC technical paper. And also here in this figure, you will click and you are going to go to this WHO web page where they have presented also a paper where they have go a little bit deeper in the assessment on how health has been included in the NDCs. So please visit these two pages to learn more about the details on how health has been included as an adaptation priority in the NDC adaptation component. Next one, please. What I want to focus now is how parties will, countries will then describe or report the progress in implementing the NDCs. As part of the Paris Agreement, one very important component of the Paris Agreement is what we call the Enhanced Transparency Framework, ETF. The idea is that parties need to report back to the UNFCCC, to the other parties, on how they are doing in regarding to the NDC, how they are progressing in implementing the NDC, and at the end of the NDC cycle, if they have achieved or not the targets. So we have created through the Article 13 of the Paris Agreement, what we call nowadays the Enhanced Transparency Framework. And basically, under this framework, all parties of the Paris Agreement will have to send to the UNFCCC biannual transparency report. So every 2 years, parties will send this report where they will include information, for example, on the greenhouse gas inventories. They will include information on tracking progress in implementing and achieving NDCs. And within this information, particularly the information to track progress, the NDCs, they have to report the policies and measures that they are implementing to mitigate climate change, to reduce greenhouse gas emissions. These policies and measures are the countries, they will decide what are the best ones for implement to achieve the goals of the NDCs. And they may include, as part of the information of the policies and measures, what is called the non-GHG mitigation benefits or co-benefits. And definitely here, we can expect it that many of these policies and measures, if not all, will have a non-GHG mitigation benefit, a co-benefit that is related to health issues. So it will be very interesting to hear from parties what are these co-benefits related to health. They don't have the obligation to present this information, but we hope they will present this information. Details on how this information can be presented or should be presented are in this decision 18 CMA1, that is the decision that brings the modalities, procedures, and guidelines for the Enhanced Transparency Framework. And particularly the paragraph 883B is the one that gives this put this request to parties to provide information on non-GHG mitigation benefits. So how deep they will go in this information, what kind of detail, particularly related to health issues they will provide, we're going to have to see. But there are some guidance that they can use here. And in the figure that you see here, you're going to click and you're going to go to WHO website. And there are two papers there that are very interesting that I recommend you to read, that are the co-benefits of climate action in two sectors, the transport sector and the building sector. So please go ahead and read those documents because they were going to be very good insights on how, what are these impacts. And once again, I hope parties, once they realize the impacts that this mitigation has on health issues, they will report back to us through the biannual transparency report. Please, next one. Another opportunity that parties will have to talk about health adaptation priorities within the biannual transparency report, or sorry, in the Enhanced Transparency Framework of the Paris Agreement, is to provide in general information on adaptation. And they have different ways to do that. They can provide what we call an adaptation communication, that is a standalone document or a document that you can, and some parties have done that, include as part of your NDC, where they will go in much more detail on the adaptation component of the NDC. There is one specific decision to guide the elaboration of adaptation communication, that is decision 9 CMA1. They could include also the adaptation information as part of the biannual transparency report, as a chapter of this report. And for that, there is this chapter 4 of Annex to Decision 18 CMA1 to guide the information to be included in the BTR. And finally, they also have what we call the national adaptation plans. Doesn't matter really where to include information. What's important is the content of information. So parties will decide if they present adaptation communications, if they include adaptation information in the biannual transparency report, or if they will continue to do national adaptation plans. Once the information is there, it's important to clarify that it's information that is not, they don't need first. They don't need to present information, but I believe everybody will do that because it's interest for the country to present the information on adaptation, and unfortunately, it's something that we all need to go through. And once the information is presented, it's not part of what we call the technical expert review. We have decided under the enhanced transparency framework of the Paris Agreement that the biannual transparency report, once is submitted, the national greenhouse gas inventory, the information to track progress in the mitigation component of the NDC, and the support provided by developed country parties will be subject to a technical expert review. But recently, some parties, they start to request, or they want to have the options that the information on adaptation should also go through the technical expert review. So one important element that will be discussed and negotiated and decided in COP27 is these options for conducting reviews on a voluntary basis of the adaptation information. And also relate to that, the need for some training courses. So for those of you that will be involved in COP27, this is an important topic to follow up these discussions on this voluntary review of the adaptation information. We're going to discuss a little bit more about that later. Next one, please. So here, let's put a question. What will be then the necessary expertise to review adaptation, in particular review health adaptation priority? So myself, if I go to a technical expert review, if I be part of a technical expert review team, I will not be able to discuss or to assess this information because, as I said, my background is transparency, is mitigation. I don't have the background on adaptation or on health to be able to read or to assess the information that will be presented as part of the biannual transparency report. So we're going to have special expertise. This is why we are also discussing these training courses to experts that want to go and collaborate with the voluntary review of adaptation information. But there are some guides or some rules already established of what the experts should not do. For example, they should not do any political judgment about the country. They should not review the adequacy of the NDC. I will not be allowed to say, well, I don't think your adaptation priorities are the right ones. I don't think your mitigation target is ambitious enough. So there is some rules already defined to guide the work of these experts in the sense that they are there to support the countries in better reporting information in the future. So at the end of the day, what we expect from these technical expert review teams is that they will engage with the party and at the end make recommendations on how to improve the quality and the transparency of the information provided. And of course, for developing country parties, these experts can also identify some capacity building needs. So when we have the opportunity to review adaptation information and there are health adaptation priorities there, we hope these experts can also guide or help assist the party to say, well, maybe this adaptation information or this health adaptation priority could be better explained like this, or we can have another cases or examples to be used to guide, to inspire the country in reporting this information in the future. So I hope some of you in the future participate, particularly those of you that have the health expertise. I hope you can participate in these reviews and then collaborate with the country to improve the transparency and the quality of the information to be reviewed. Next one, I think, is the last one. This one, Christina? Yes, that's it. So once again, thanks for the opportunity. As I said, it's a very quick and specific highlights that I want to give here. There is much material and information in the training courses of UNITAR. So please, those of you that have not yet engaged in this training material, I encourage you to do so. And I will be happy also to respond to some questions if there are. Thank you so much.
Thank you very much, Marcelo, for this very interesting presentation. Now we have the opportunity to open the floor for Q&A for anyone who has any questions to ask to our expert. I see already a couple of raised hands, so we'll start with Philip. Please, if you would like to ask a question, you have the floor.
Good morning. Thank you for the presentation. Since we are talking about climate change here, there's a question that I didn't get a chance to ask yesterday. Also, I'm sorry. My name is Fela. I'm from Namibia, and I'm an environmental health practitioner, registered police officer. The question that I have is that in Namibia, we have a criminal procedure act that mandates the seizure and disposal of articles that can afford as evidence in judicial proceedings. And once concluded, the articles are due to be disposed of. And most of the time, due to the literacy rate in our country, which is personnel that are designated to dispose of these articles not environmental conscious. And the traditional way that we do this most of the time is like open dumping and not exploring other options such as instituting the Basel Convention, whereby you can really take the waste or to a country which has the capacity to actually dispose of the waste. What advice would you actually give? What technocratic advice would you give in this issue now? Thank you.
Thank you, Philip. I'm sorry if maybe I missed a little bit of your intervention. At least from my side was some problems with your sound. But anyway, let me try if I understood correctly. You are requesting some advice related to waste disposal, waste management. I'm not an waste expert, but what I have seen in terms of practices in other countries is to have try to have a more integrated approach and combine different types of technology, starting with recycling and then, of course, using different types of waste management disposal sites. And some of them will have, depending on how you do it, it may also have greenhouse gas emissions associated with that. So if you have your waste in a landfill, most likely you will have methane production in this landfill. And therefore you have to, in this case, also have what we have as technology nowadays to capture and to use this methane to produce energy. So there are many different types and technologies available. I encourage you within the UNFCCC website to go through some of these NDCs, and in the NDCs you're going to find some of countries have target specific the waste sector. So again, sorry if I not get all your question because of the noise or lack of the sound that I have here, but anyway, we can do this bilaterally later on in more details if needed.
Thank you, Marcello. And just to complement, if you're interested in this topic, I would like to let you know, Philip, that we just launched a new course on e-waste yesterday on the UNCC e-learning platform, and also a month ago, a new course on food waste. And there are also a couple of courses on conventions that have some relations also to these topics. So my colleagues perhaps can share the links in the chat for your reference, and you can go onto the platform and explore this topic a bit more there. Great, I see Sivakumar. Please, you have the floor.
Yeah, this is Sivakumar. We were on the health field in environment since 12 years. So this question is for total UNITAR and UNICEF even. Like there, with the maximum populated country, India is an endangered environment. And I just want to know what are the steps this UNITAR is taking towards India for conservation of the environment and species.
So your question, sorry, is on the conservation of species, like natural environment.
And like environment, like there are many medicinal plants and there are many rare plants in India. So, you know, this deforestation has become a very common trend in India, and there are thousands of trees which have been cutting down daily. So how UNITAR is helping India to save the environment?
Thank you for this question. So as the UNITAR representative here, I will start, and then perhaps ask Marcello if he has more general information maybe he would like to share related to maybe NDC's commitments and so on. Just to say that UNITAR, the mandate of UNITAR is the name says, the United Nations Institute for Training and Research. So it's about the promotion of learning and capacity building, particularly of government officials and now more and more other stakeholders, much broader stakeholders involved in climate change. So the support that UNCC provide at UNITAR actually provides around the world is focusing on these elements. And that's why we are talking, for instance, about the e-learning courses on the platform. Here, I would encourage you to check a course on RED+ that we've launched a couple of years ago and is then being updated, which really deals with questions of deforestation, for instance. And I would refer for further information to other UN agencies that perhaps work on reforestation, on the conservation of specific species. There is actually a specific convention. That's what I can say with regard to the work of UNITAR. I don't know if Marcello, you want to highlight something with regard to the NDCs and forestry.
Yeah, no, I think this is also a very important topic that has been covered by the NDCs. That is how to reduce deforestation or forest degradation. And Christina has mentioned RED, that is an acronym for reducing emissions from deforestation, forest degradation, enhancements of carbon stock, and sustainable forest management. So I also encourage the participants to go through the NDCs, particularly of countries with large forest areas like Brazil, Indonesia, India, and then you're going to find how these countries aim to reduce deforestation. And one way to do this is to use this instrument that is called RED. So there is a lot of debate around this, a lot of information that you can find both in UNITAR training materials and the UNFCCC. So this is something that I recommend you to do. Thank you.
Thank you. Great. I see NASA afterwards.
Thank you so much to everyone on the platform and UNC. I hope you can hear me. My question is, we really appreciate the efforts you're doing this. And so I wanted to know, are there resources whereby, because myself, I'm into film and television production, and I have since over like 10 years been dealing with children's shows, and I've seen the need to create content that speaks to the beautiful world environment which you understand? Is there on your platform a resource for me to use to build content to engage children and help them to be aware and understand what climate change is and how we can help them? I hope you could hear me.
Yes, if I understood correctly, the question is about the availability of materials and resources that could be used to educate children on the issue of climate change, if I understood correctly, because the sounds broke a few times. If it's not correct, please let me know. But to answer this question, yes, please feel free to refer to the platform. There are lots of materials. Of course, they're not targeted primarily at children, but you can draw information from those courses and adapt this information for your courses and materials. That's no problem, as long as UNCC Learn and partners are acknowledged. But these resources are publicly available with the aim of promoting climate literacy, of course. There is a specific course on climate change and children you may want to refer to, which was developed in collaboration with UNICEF. And in addition to the e-learning platform, you may want to check the UNCC Learn knowledge sharing platform, which also provides a multiplicity of other resources that are not e-learning courses, but still relevant to educate and train different stakeholders on different climate change topics, in particular a library with 3,000 publications from the UN system. And I'm sure you can find also further materials there. And finally, you may want to check the Youth Climate Dialogue Initiative organized by UNCC Learn, and I'm asking here my colleague Julia perhaps to share the link as well in the chat, and you can find more information about this initiative. I don't know if, well, Marcel, is there anything you want to add? This question was really specific to UNCC Learn, but...
No, I think it's important to stress, Christina, the importance that we have to make this information more accessible, particularly for young people or other groups that have not the necessary technical knowledge. And here I also want to stress that all these reports that I have mentioned under the UNFCCC, the NDC document, the adaptation communication, the biennial report, at the end of the day, they may be a little bit heavy to the general public. So I encourage countries and also participants here to, once they have access to this material, they also try to see how they can facilitate the access to the material and to the understand of this material. It's very unlikely that everybody will be able to read hundreds of pages of a biennial transparency report and understand everything. So I think we have here a job as technical persons to facilitate this, the understanding of this information. So I thank you, UNITAR, for these initiatives, but I think it's something that we also can do at the personal level as well. Facilitate the access and the understanding of this information is very critical and important.
Thank you very much, Marcelo. Next in line is Mohamed Munir. Please go ahead. You're muted. Sorry, Mohammed. We cannot hear you.
Yeah, good morning, everyone. I'm Mohamed Munir. I'm speaking from Cameroon. My question will focus on nitrogen-based fertilizers. Research on agriculture, since we talk of climate negotiation, and we are aware of the fact that nitrous oxide accounts for the top 3 greenhouse gases. And this is particularly caused by the use of nitrous fertilizers. We are talking of climate negotiation, and we know what to do, that we need to start cutting down the use of nitrous fertilizers in order to have a chance of facing climate change. So what is to be done to establish a policy that can make us to less use these nitrogen fertilizers? Thank you.
Thank you, Mohamed. Yes, you are right, because in the agricultural sector, one of the main emissions are related to use of nitrogen. But I don't think here we will be able to reduce radically the use of nitrogen. We have to have this for crop production. What we need to do is to have a more efficient use, and in some cases, choose alternatives, organic fertilizers. And this will have for sure also a health impact, because if we have this more sustainable production of food with better quality, this also will have very good impact on the health of people. So here, just to bring your question to the topic of this webinar, I will encourage us to make a more efficient use of these fertilizers, to find alternatives, organic fertilizers, or to go for a more sustainable and organic food productions that definitely will also have very positive benefits on health. Thank you.
Thank you again, Marcelo. There are still 5 questions, and we have to close our Q&A in a few minutes. So perhaps I would suggest we take the first 2 questions together, and then Marcelo, you can answer them, and then we take the last 3. Saifur, perhaps you have the floor.
Yes, thank you very much for this opportunity. This is Saifur Rahman, working for Care Bangladesh in Cox's Bazar. I have a very short question that today we are talking about the climate justice. So how we are ensuring the participation of affected population who are really affected through the climate change and through the negative climate impact. Thank you.
Thank you, Saifur. And then Syed Nur Alam. Syed, please go ahead.
I'm not hearing.
I cannot hear you.
Okay, so it's general. Okay.
Can you hear us? We cannot hear you, unfortunately, but perhaps you can type your question in the chat. Yeah, unfortunately, we cannot hear you. Maybe we can ask Akansha in the meantime. Please go ahead. We cannot hear you either. Marcelo, can you hear?
No. These 2 last people that you have called, I was not able to hear from them.
Okay, I encourage you, Akansha, to write your question in the chat as well. Unfortunately, we cannot hear you. And then Ibrahim, then.
Hello, good morning.
Yes, I can hear you, Ibrahim.
Perfect, yes.
Hi, okay, I'm Ibrahim from Nigeria. Mine also is just a very short question. I had the concerns of Mohammed earlier about the nitrogen-based fertilizers. I don't know if there are any like volunteer organizations around here in West Africa where we could, sensitize people, because I feel most people here don't know the impact of these climate change and also the fertilizers they use, to grow food. So I don't know if there are maybe volunteer organizations around that one could join. Like me personally, I'm from the finance. I'm from like finance background, so where I could join and impact on people, just sensitize them about climate change.
Okay. Well, let me start by this second question. I will not be able to give you names of organizations now, but
Okay.
For sure, FAO is doing a very important work on climate change and particularly the use of nitrogen. So maybe one way to start is to look FAO in our country or in the region. I know that it definitely is working very hard on Africa on that. And then on the first question, if I got it right about the participation, one of the characteristics of the NDC is that they have been decided in the country. So, of course, each country have different approach to come with to develop and to present and approve the NDC at the country level. But we expected that there was a lot of participation of different groups in the discussions of the NDC before it has been presented to UNFCCC. Of course, there always room for improvement to engage more and more people. And nowadays, my personal view is that more and more people are aware of climate change and are willing to engage, but come back again on how they can engage if they have the necessary information and knowledge for that. So these kind of activities that UNITAR is promoting, and as I said before, our job as technical persons to try to translate to these people the information so they will be better prepared is always something that we should keep in mind, because then more and more people will be engaged, not only in debating and deciding on what to do, but also how to do it, and then doing the things as well. Climate change is something that cannot be only solved by governments. We need to have the private sector, we have to have NGOs, we have to have the civil society, we have to have everybody on board doing the different tasks that they can do to tackle climate change issues. I hope this answered the first question. Thank you.
Thank you. I see more hands raised. Unfortunately, we don't have time because we have a next presentation, but actually there is still Frank from the list of people I mentioned earlier. I would like to give him the floor, and then Akansha, since you were still in, you tried to speak before, if you can try again, perhaps you can take these last two questions.
Yeah, thank you. My question relates to like universal health care and the fact that we're discussing negotiations and climate health. Climate negotiations and climate change. So I was just wondering, because countries of the global south are disproportionately affected by the effects of climate change, and I know that in many countries in the global south, there's a discussion on universal health care. So I was just wondering if there's any convergence between the package that's being negotiated for the global south and whether universal health coverage, or rather health, is a central component of the package that's being offered, that's being put on the table for countries from the global south to mitigate the effects of climate change. If anyone has any insight on the centrality of healthcare as a consideration for the package that's being considered to help countries from the global south.
Thank you. And Akansha, you can hear us now. You can share your question at this point. Unfortunately, we cannot hear you. Marcelo, can you hear?
No, unfortunately not.
I would suggest then that perhaps you can go ahead and answer Frank's question.
Yeah. Thanks, Frank. I will not go in details on health systems. I believe our colleagues on WHO can do that. But you have raised one important thing, that is the support to be provided to developing countries, both to mitigate climate change or to adapt to climate change. And once they have the finance, the technology, the capacity building, then of course each country will have different priorities, and some countries I believe they will put the effort on health systems because of the impacts of climate change. But I just want to stress that in any COP, and COP 27, that it will be an adaptation COP, for sure Together with that, a lot of emphasis will be given, or developing countries parties will try to give a lot of emphasis on the support, because at the end, what we know for sure is that the support that we have nowadays available is not yet sufficient to tackle mitigation and adaptation, particular adaptation. So there is always this request for more money, more technologies, more capacity building. And this is always a big issue in any climate change negotiation, how to improve the amount of support available and how to facilitate the access of these to this support. So be assured that COP27 will not be different, particularly being an adaptation COP. There's going to be a lot of requests, demand for more and more support, because there is a real need for more support. Unfortunately, we don't have yet all that is necessary. Thank you.
Thank you. Thank you very much, Marcello. I see there are still 6 hands raised. I'm very sorry, but you're already over time. We cannot take any more questions at this point, but we are going to have another Q&A after the following presentation. So you still have a possibility to ask your question there, or you can also ask your question in the chat here, and we'll try to reply through the chat as well. So at this point, I would like to give the floor again to Marina during the next segment, and she will illustrate WHO COP27 priorities on climate change and health.
Thank you, Cristina. Thank you, Marcello, for the great presentation, and I see lots of interest. So I will try to summarize our WHO key message and presentation as much as possible, to reopen, as Cristina mentioned, more Q&A to continue sharing views and ideas. Sorry, viewers. Let me see if I'm sharing my screen. Can I confirm you can see my screen now?
Yes, we can see it perfectly. Thank you.
Wonderful. So once again, thank you so much for joining this webinar, and then for the interest on climate change and health. So Marcello provided a great overview on the negotiations, new negotiation tracks, and a relevant entry point for the health community. From my side, what I'm trying to do now in the next 15-20 minutes is to give you an overview of what WHO is doing on climate change and health, why we are working on climate change and health. Well, should be very obvious, and the picture that we put in these first slides is representative of the key answer why we're doing this. For us, the climate crisis is a health crisis, and this is a nice picture taken from last year, COP26 in Glasgow, and it is an action organized by colleagues from MEDAC. So just want to mention this, not to take the credit over the picture. So oops, okay. So first of all, I want to tell you what is the key focus area of the work WHO is doing on climate change and health. For us, the most important thing is really to advance climate resilience health. And we work in 3 main topics that we can summarize in this infographic, being addressing the wide range of health impacts of climate change, and strengthening the climate resilience and environmental sustainability of health system and health facilities. And then we do promote the co-benefits of climate change mitigation from other sectors. We'll tell you more about what we mean for that during the course of my presentation. But then let me start basically highlighting why for us it's so important to address climate change as a community. Climate change is undermining the key determinants of health, increasing diseases and death. And this is, is a common knowledge. Everybody is unfortunately experiencing the impact of climate change on a daily basis, with floods, wildfires, increase of vector-borne diseases. And actually, the reason why we put this graph in this slide is to highlight the result of a recent review that we have done with our member states, with the Ministry of Health, representative of the health community responding to questionnaire from WHO, highlighting which are the key area they see impacts from climate change. As you can see, increase of water and foodborne diseases, injuries from extreme weather events, airborne and respiratory diseases linked to air pollution, heat stress, malnutrition, zoonosis, mental health is coming up more and more as a clear public health issue linked to climate change. And this is not only the results of the WHO survey, it's unfortunately also confirmed by the latest IPCC report, the sixth assessment report that is focusing on health. The health chapter is confirming that we have more and more increase of adverse impacts on human being and well-being due to increase of infectious diseases, malnutrition, mental health, displacement, just to confirm what our Ministry of Health has confirmed to us, as you could see in the previous slide. So I see from the poll that most of you comes from the environmental side. So I'm sure I don't have to spell out IPCC just in case, for people that maybe are new to the topic, the Intergovernmental Panel on Climate Change is the most important scientific body that is serving the climate community, the global community, understanding the climate change impacts and collecting all data evidence on how the global warming is advancing and continue developing and with projection toward the future as well. So, but basically, I know that some of you would love to know more about climate change and health impacts. We have a beautiful training produced with UNITAR that Christina presented. There are more information there that you can find in the introductory chapters. Plus, I will give you some more reference while going through this presentation about the products that we have, tools from WHO, our key publication. I would like to focus now on the rest of my presentation on what we are preparing as a health community, as WHO, to present and to contribute to the upcoming COP27. Again, COP, as you know, conference or party. These are the Ministry of Environment gathering every year to try to reach agreement on how to reduce emission. And then the WHO and the health community are trying to participate to increase the health influence of these in these negotiations. We are supporting the participation of national health representative in the national delegation, and now we're also strengthening the advocacy and the partnership with several partners from NGOs, academia, other UN agency, and we try to really promote health across as a cross-cutting issue. We referred before to co-benefit, what we mean for co-benefit. And once again, it's pretty obvious to us as a community that any action that you take on climate change, reducing emission means increasing health. If you promote sustainable transport, you promote active mobility, reduction of cardiovascular diseases comes with it. And if you invest in renewable energy, you automatically cut down the emission that are also contributing to air pollution. And then you are tackling a very important public health issue, problems of the 7 million premature deaths every year by air pollution. If you invest on a smart, sustainable agriculture, you promote, of course, sustainable diets. All this has an impact on health. So for us, the co-benefit, everything that the climate change community, every sector does to reduce emission has an health impacts. And we really bring in this as a positive motivational message to the COP. But then in this slide, you see summarize the key action that we are taking in preparation and during COP. So we are engaging in negotiations, we are organizing health side events, and we are preparing training, and as this one that we are discussing in this webinar. And then since 2 years, we are investing a lot of time and energy on the preparation of a dedicated space for the health community. The COP20 is called the Health Pavilion. And in particular, this year is very busy for us because we are trying also to support the Egyptian government and the presidency initiative. There are several interesting initiatives coming up that will be announced during the COP27. One is on women's health, gender, still to be well defined, nutrition, a special initiative on climate change and nutrition that will be launched in collaboration with WHO and the Egyptian government. Youth, for the first time ever in the history of the climate change negotiations, a presidency has appointed, for you, maybe many of you know already this, but then the presidency has appointed a youth special envoy. And we are so glad as a health community that this envoy is a very, very close friend and collaborator of us, a former medical student from the International Federation of Medical Student Association. She's called Dr. Omnia El-Ormani, and then together with her, we are organizing also special forum, special dialogues on climate change, on intergenerational dialogues between on health and climate change. I will give you more details also later about this. So, and then sorry, just as I move too quickly, I just wanted to mention also that other important initiative ongoing are on cities, and there is not a dedicated health day, but then we have special dialogues and talks during the Science Day on climate change and health. Our stakeholder engagement span from like connection, of course, with member states, NGOs, other agencies, the private sector. So, but on top of this type of engagement during the COP, we are also preparing prior to COP a series of science policy brief and submission that we will share with all of you if you're interested, and it will be added also to the training, online training as resources. We are working on several key issues related to ongoing negotiation tracks and to highlight the connection between health and climate change. First of all, we are doing a review of the IPCC evidence, the latest report I mentioned before, to highlight all the key evidence on climate change, health, and well-being. We are working on a dedicated brief on short-lived climate pollutants and air pollution. We are working on loss and damage, the health position on loss and damage. You know, this upcoming COP, it will be a fundamental one to advance the agenda on loss and damage. And then we'll take a global stock take position from the health community, working again on food system and agriculture, and then additional also position paper and briefing on this intergenerational equity dialogue between climate change and health community. And I put energy and water down in this slide to remind everybody that this COP focus will be about, first of all, well, finance. As you know, this is an African COP, and then the government of Egypt will love really to push the commitment from high-income country to support the implementation of Paris Agreement, the finance support to lower-income countries, country that are most vulnerable to climate change. But also they are raising the issue about, for us, priority are energy, water, and nutrition. So although there is not an health clear focus for us and the health community that we are working so closely with all the sector, for us, it's an incredible opportunity to really raise the famous awareness about the co-benefit generated from other sector. And then we take the occasion in this COP also to promote our newly established Alliance for Transformative Action on Climate Change and Health. It's called ATTACH. It's a WHO-led mechanism to support the implementation of COP26 health commitments. So, and so what are these COP26 health commitments? I will tell you more soon. Just want to remind everybody that this is led by WHO, but with the support of the UK and Egypt governments, and basically both of them presidency of COP26 and COP27. Indeed, last year, for the first time ever again in the history of negotiations, a COP presidency, the UK, has put a special emphasis on health, the health sector, and then has called for special commitments, 4 main initiatives, one on climate resilience health system, one sorry to move slide. One on health leadership in emission reductions. The other initiative was about promoting healthy end disease. You heard more from Marcelo before about the national determined contribution. We really work a lot, and we're still working with the global health and climate community to make sure we promote NDCs that have an health focus, and then they highlight health benefits. And also together with UK last year, we had organized a big initiative to mobilize health voices for climate action. But then going back to the COP26 health commitment, we have more than 60 countries that committed last year to the WHO-led initiative on climate resilience health system. So I want with these slides, sorry, I see time is running, I'm accelerating a little bit. This presentation will be made available, but then, and then we can also go back to some of these slide elements of my presentation in the Q&A if you want to go deeper in something that maybe I cover very quickly. I put here this slide to remind everybody also that, I mean, WHO is working to support countries to build resilience and adaptation to climate change for on the health sector, on the health system. But we are also aware of the fact that as a sector, we are also contributing to climate footprint. 4.4% of greenhouse gases emission are estimated to come from the health care sector. In particular, over 70% of these carbon footprint comes from the supply chain. So we are working also together with partners to tackle this issue about committing to reduce our non-carbon footprint. And do our health services more sustainable, in a more sustainable way and with a lower carbon footprint. But the key mandate of WHO is really to support countries to develop climate resilient environmental sustainability in healthcare facility. We do have guidance and country support program specifically dedicated to climate resilient, environmental sustainable healthcare. You see the reference here, but you find more information again in the beautiful online training that we hope you took already or you will do after this webinar. And just again on this ATTACH initiative, just you may wonder what the country have committed to. Here you have a list of key commitments. So the more than 70, the 60 countries have committed to conduct climate change and health vulnerability and adaptation assessment, both for population and healthcare level, and then develop national adaptation plan for the health sector, so the so-called HNAP, Health National Adaptation Plan. And then also it's interesting to see from these commitments also specific dedicated commitment from high income country, from high ambition, high emitters country that committed to also reduce the carbon footprint of the health system. The ideal target that is reduced to net zero emission by 2050. We have some healthcare facility, healthcare organization like NHS England that have clearly openly committed to this, and others that are working on it. But also we have several donors countries that committed to increase their own finance support to come to a low-income country that are building really the resilience at the adaptation component of the national health system planning. But last things about attach is a mechanism that foreseen the participation of country, developing agency, technical expert, academia, NGOs. If you're interested to know or to learn more, and if you belong to a country that is not yet committed, or you want to know more about what your country is doing in contribution and support to this attach, please come back to us with question. Be happy to put you in contact with expert and the team coordinating this special alliance. Then mention that, just going back to what we do for COP, the training for health professionals, the climate change and health training that we are promoting this webinar is supposed to be for health professionals. They want to learn more about climate change negotiations, but we thought because it's so broad and covers both the history of climate change, the negotiations, the reference to the health sector engagement in negotiation, but also gives an overview on health and climate change. We thought it was nice to open to more participants, especially this online training. And then we are very glad to see there is a variety of background in this call, and there are lots of environmental people that are taking this course. Super glad and to see this. But just as an additional information, and I hope it goes in with a clear understanding, that we do have funds, indeed, thanks to collaboration with Wellcome Trust. We have funds to support 10 representatives of Ministry of Health from the Africa region and the Middle East region. So I want to really make sure that you understand this is for Ministry of Health representative. So if in this call there is anybody from the Ministry of Health of countries that are interested to join your national delegation at the upcoming COP, but you cannot make it because you have financial constraint, please come back to us and contact us. It has to be clear. You need to represent your country, and you need to be approved by your national delegation to participate as a real negotiators. You're not just attending COP side event and participate as a normal participant. You should be really your national delegates. So if there is anybody, feel free to connect to us so we can see if they can open some opportunity. Then the last things I wanted to tell you about COP, well, we are going to have a beautiful dedicated health pavilion. You see the preview here of what the pavilion will look like. We received more than 200 applications for side events and talks around climate change and health. We managed to select only 40. And then we are preparing while we are speaking the overall program. The interesting element this year of this pavilion is we are bringing a piece of art. So as you can see from this simulation, this piece of art that we are bringing is a sculpture representing lungs. Is a real tree that is casted in aluminium and is put upside down to give the real feeling that we are embraced by lungs. And for us, lungs are an important part of our body that reminds, unfortunately, the clear connection between air pollution, climate change, but the fact that they are made with the trees also connect us to the reminder about how we are linked to nature and to all the eco services that nature is providing. Anyway, we don't want to go too deeply and too long on this. We are very proud of this new approach we are taking, bringing a piece of art to really raise awareness and making clear the connection between climate change, health, and nature. And we are very lucky to collaborate with a group of artists by Invisible Flock that are part of a broader project of Wellcome Trust called Land Body Ecologists. If you're interested also on these piece to discuss later on on, and if you have in your own daily activities also connection with artists and that are working at the intersection between art, science, and advocacy, come back to us and propose maybe something new as well. Super quickly, I think we are super running over already at the Global Youth Forum on Climate Change and Health. I mentioned just at the beginning of my presentation that this year we have the pleasure to work with the co-presidency with the special youth envoy and then we are organizing together with the Federation of Medical Association and GGCH dedicated forum on climate change and health. We had already the 2 days online consultation last weekend, and we will organize a face-to-face high-level gathering of youth around the topics of climate change and health. And then, yes, so the last things I wanted to mention, again, in interest of time now, I'm not going to read all of this, but then we are bringing as a climate change community some key message to COP. These key messages are coming from a super important publication that we have published last year for COP26. Is a special report from the health community to the climate community called The Health Argument for Climate Action. You will find the references again on the online training. This is really a great report to read. Is a summary of everything that community is raising awareness on, and the key message about that I was discussing before about understanding that every climate action you take is a promotion of health and is a great advancement in the public health agenda. Some of you before asked whether there is a connection between the public health agenda and the climate agenda. Not yet clearly on negotiations text. This is the reason why we are participating, trying to influence a little bit this negotiation to really make sure that attention is given to the health argument to really increase motivation for more action, because more action means more health. But have a look at this report. The presentation will be given to you. Go through the key recommendations, see if they resonate with you, with your work. If you want to use it and disseminate, you're very welcome. The very super last information I just want to give you, just because it's very timely, is today we also today a group of cyclists, healthcare, and specifically health and pediatric expert, pediatricians. They are leaving Geneva by bike, and our team leader, Dr. Campbell-Landrum, and some colleagues from WHO are actually cycling with them to go through several stops towards Switzerland, Italy, up to Naples, and to stop in a healthcare facility, in particular pediatric hospital, to raise awareness about the importance of acting on climate change or reducing air pollution, because the most important reason is because of future generation children health. So it's just a nice alternative, additional way we are using to raise awareness. And if you are a cyclist and you live anywhere between Geneva and Naples, please check the webpage, because you may want to join some of these length. And anyway, it's great to speak to you, and I would love to share lots of more information, but time is running and I have to go to give back the floor to Christina for more Q&A if we have time. I'm afraid not. And over from my side.
Thank you. Thank you very much, Marina, for this very interesting presentation. There are 4 questions, so perhaps if you have a few minutes, we can try to get them all together, maybe. Maybe I can ask Simon to share your question.
Good morning. I'm Simon from Mozambique. Thank you for your presentation. really, we know that the climate changing is impacting negatively the health. That's why it's a big topic today. Then what I would like to ask you, according to your explanation, is what we can be done to reduce the GEE emission to reach the net zero carbon until 2050, because we know that the climate changing is there's a big problems and our health is in risk, in danger. Then how can we do to really reduce or reach the net zero? Thank you.
Thank you.
You want to collect more questions?
Maybe we can collect all the questions so that it's perhaps faster. Then Gunit, sorry for my pronunciation.
Good afternoon. Mine is a very niche question. It's related to shipping. So shipping is, a significant emitter, but not really in the public consciousness. So I just want to find out, like, what are the various educational aids being provided for training the people that reducing emissions from shipping requires like an end-to-end. So each country has to contribute towards it. Whether supplying fuels, collection of waste, so that the oceans don't get affected.
So
is there any?
We cannot really hear you. There's a lot of background noise, unfortunately.
I'll try and please one.
Okay. Well, in the meantime, maybe Siva Kumar.
Yeah. One more question for WHO and UNITAR regarding the health complications and environment conservation. So the meetings which you are conducting and COP27 and other courses are for the people who are interested to know about environment. But how can you bring motivation or stop or ban people who are making their revenue from destroying environment? How WHO and UNITAR and other UN agencies are stopping people who are making revenue from destroying and disturbing environment?
Thank you, Siva Kumar. Vaishali?
Yes, good afternoon, everyone. My name is Vaishali and I'm joining from India. So thank you for bringing this webinar. And my question is collectively for climate change adaptation and women health in specific. If I'm audible? Am I audible correctly?
Yes, please go ahead. We can hear you.
So my question was that as WHO, that collectively WHO and UNITAR, that are there any training courses or online training courses for in specific if any individual or institution wants to or interested into awareing people about the sustainable menstruating, what do we call it, habits, how to bring, how to develop the sustainable menstruation habits. So are there any specific courses available, or in specific we have talked about NDCs, then I would like to ask that are there countries or have their countries directly or indirectly have considered this topic, considering the women's health issues in their NDCs? So thank you so much.
Thank you. And we can try Gunet. Can you hear us?
Would it be okay if I typed out the question in the chat instead?
Yes, absolutely. Okay, so.
Okay, yeah, very quickly, and thank you for all these super interesting questions, and in particular to the first one about how we do reduce greenhouse gases. Well, this is a big question. In fact, this is what countries are trying to figure out since 27 years. But in particular, as I mentioned, what we do with WHO and collaboration with systems around the world is look at the carbon footprint of the health facilities, the health system. So what we can connect and give you more information. There are colleagues also of mine in this call dedicated to country support and assisting with key tools on how to reduce carbon footprint at the healthcare facility level. But in particular, we are trying to tackle this supply chain, the procurement of items. This is an important a way of reducing emission. Transport as well. For example, we have a great example of NHS England now investing on electric ambulance. There was actually the exhibition of the NHS ambulance at COP26. This is also how the health sector is advancing, really changing the way we provide healthcare services to make sure we have a minimum impact on the environment, and then the procurement of sustainable food produced locally. Well, and there is a lot that we can do, and then there are nice guidance prepared by experts from the WHO and an international expert working on this and sustainability. And I will invite you to have a look. Then on the question about, I mean, what we do. I mean, we are teaching to people that, as we can say, we are already converted and they know about the problem. But then how do we reach out to people that unfortunately have activities that are destroying nature and producing the problems? I'm afraid UNITAR and WHO, I don't know if UNITAR has the power, WHO does not have the power to really suit these people, to put them in jail, to punish them. What we we raise awareness, and we actually try via the dialogue with the countries, representative of member states, at national level, we really raise awareness. Our mandate is to raise awareness and to promote alternative solutions that can generate business in a sustainable way. Then if the business world is listening to us, I'm afraid is out of our control. But maybe, Christina, you have a better answer for this one. And then and the question about women's health and all broader approach to how we support women to adapt to climate change and take into account some very specific health issue to women. Yes, we are working on it. We will have at our health pavilion a dedicated dialogue on gender and women's health. And I want to remind everybody that this health pavilion is an hybrid pavilion, meaning that all of you, even if you're not attending COP, you can connect. And I don't know if Alessandra, my colleague, is still connected, if she can put on the chat a link to the page where you can find the web streaming of all the dialogue and talks we do at the Health Pavilion. You will find a dedicated one on women's health organized with UN Women, UNICEF, UNFPA, and various stakeholders raising really awareness about the health specific women issue. So yes, it's an important one. And then I don't know if Gunnet managed to put his question on the chat. Help me, Christina, to see if
there is a question from Gunnet about the shipping sector. And emissions from the shipping sector. One of my colleagues shared actually a UNCC course on this topic that you can refer to, Gunnet. I don't know if Marina, you want to add anything else?
No, well, I wanted to refer to you and to our colleagues from the UN agency, from ICAO and IMO, the International Maritime Organization and the International Civil Aviation Organization. These are our partner organizations that are working really on shipments of items. So I would love to invite you to have a look at their material and UNITAR training course as well. So thank you so much to all, and back to you, Christina.
Thank you so much. We are now at the end of our webinar, actually running a bit over time. Thank you all for staying with us. Thank you to WHO colleagues, Marina in particular, and Marcelo, our trainer, who also stayed a bit longer. We will share the links to the recording and the resources, the PowerPoint presentation, where you can access further information, and we encourage again you to check the e-learning course also if you haven't done so. So thank you so much, and we wish you a good day and hope to see you